Has begun.
Good evening. Welcome to the Resuming the Star Rated License Reassessment webinar. Thank you so much for joining us. I'm Allison Kiesler, the Policy and Planning Unit Program Manager within the Regulatory Services section of the Division of Child Development and Early Education. And I have a colleague with me who will be co-presenting today.
Hi, my name is Tori Black, and I'm the Child Development Early Education Consultant.
In addition to Tori and I, we also have Lori Pugh, Regulatory Services Section Senior Manager, and Leah Rucker, State Anchor for the North Carolina Rated License Assessment Project. We're excited to share some important information with you today. But first, the format of today's webinar is an informational session. If you do have questions, we ask that you place those in the chat box. And if time permits, we'll pull a few of those questions to answer at the end of the presentation. All questions will be tracked and answered. Then a Q&A document will be developed and posted on the DCDE website after. It won't be immediately after, but in a few days when we've had time to work through those questions, we'll post it. So if we don't answer your question tonight, no worries, we will get to it. The chat is at the bottom right of your screen, or should be. And if you'll just click on it, and I think Leah's going to type in it in a moment just to kind of get that started. Next slide. But before we begin our discussion about resuming the Star Rated License reassessments, I want to take an opportunity to share with you the North Carolina Department of Health and Human Services top priorities. These priorities and our work across the department are grounded in whole person health, driven by equity, and responsive to the lessons learned responding to the greatest health crisis in more than a generation. And on the next slide, we'll discuss in detail about those priorities. Children and families are at the center of our work at the North Carolina Department of Health and Human Services. Each child, regardless of their socioeconomic status, needs access to high-quality early care and learning teachers in order to have an equal opportunity to fulfill their potential and contribute to society. Early care and learning teachers provide the partnership, resources, and expertise to help families with the intellectual and social-emotional development of their infants, toddlers, and preschoolers. Investing in workforce of high-quality early care and learning teachers gives children what they need to succeed, parents the confidence to support their families and pursue their career goals, and the state a highly productive present and future workforce. So now we'll get started on today's discussion about resuming the Star Rated License reassessment. I want to remind everyone this webinar is specific to the resuming the Star Rated License reassessments and is not related to the community QRS sessions that have occurred across the state. Those are specific to QRS modernization, and while this work parallels with that, it is all about the hold harmless and when to our plans to resume that rated license reassessment. So it's hard to recall, but pre-COVID, we had a seamless system that, while maybe not perfect, it worked, and within the first 6 months of licensure, facilities transitioned to a 1 through 5 star license, and every 3 years, facilities operating with that rated license went through a reassessment process. Then COVID hit. It was a time for all of us like no other. And between the shutdowns, virtual learning needs, and health and safety concerns, the focus became ensuring on the health and safety of our families and our child care facility staff. When the rated license was initially resumed, we transitioned to a modified process that included self-assessments and less observation time. Senate Bill 570, which eventually became Session Law 2021-127, halted the rated license reassessment process, placing facilities in a hold harmless status. Additionally, those that did go through the rated license, the education for the lead teachers was calculated at 50% rather than 75%. It's been almost 2 years since Senate Bill 570 was enacted, and over 3 years since many facilities have had a rated license reassessment. Next slide, please. So where are we now? We're in the middle of post-pandemic recovery, which has left us with a significant workforce crisis. We understand that early educators that stayed through the pandemic are emotionally and physically drained. and that our facilities are able to sustain their operation only with the help of grants. A lot is happening to support the workforce crisis, to assist programs with their programmatic needs, and as you know, there is additional grant money available. Additionally, Senate Bill 291 extends the hold harmless status until June 30th of 2024 and extends the education evaluation for lead teachers at that 50% level until 2026. As you know, all of this takes planning, and one of these steps is today's webinar. On the next slides, we're going to introduce a cohort plan for resuming the rated licenses after hold harmless and what that timeline looks like. So in the cohort planning, there's 3 cohorts. The first one includes approximately 1,786 facilities and includes facilities that were due for their reassessment in 2020 or prior, and those due for reassessment in 2021. Cohort 2 has approximately 2,047 facilities, and the facilities included in that cohort would be programs that needed a reassessment in 2022 and or they're coming due for their reassessment in 2023. Cohort 3 has approximately 1,232 facilities, and the programs within this cohort would be facilities that come due for their reassessment in 2024, 2025, or 2026. We believe this is a simple plan to follow. Rather than only focusing on the facilities that were part of the original hold harmless, this plan adds everyone into a cohort, which gives each facility a preparation year. The years progress in order, so we truly are reassessing the ones that are most behind first. It's a more equal distribution of facilities due for a reassessment, and it ensures most facilities are reassessed before we launch a new system. So we had a lot of questions in the last webinar about this, so I kind of want to spend a moment on this slide to kind of give you an example. So when we say the facility year that you're due for reassessment, so if you were due in 2020 for a reassessment, that means that you were assessed, had your rated license applicate your either initial or last application in 2017. 2021, it would be 2019 or 2018, 19, 20, 20. Yes, sorry, 2018. So when you're looking at this, those are the years that you would have been due for reassessment, but you have to think through, we've been in a hold harmless since that time. Next slide, please. So as you can see on this slide, cohort 1 begins this July with a preparation year and ends June 30th, 2025. Cohort 2 begins July 1st, 2024 and ends June 30th, 2026. And last but not least, cohort 3 begins July 1st, 2025 and ends June 30th, 2027. Each cohort includes a preparation year and a reassessment year. It's important to note programs licensed after January 1st of 2024 will not be considered hold harmless, and they will not be in a cohort. The facility would be on a temporary license for 6 months and roll off onto their rated license as the hold harmless is ending. So when you think cohorts, think facilities currently operating with a rated license and those that are issued a rated license between now and December 31st, 2023. When a child care center or a family child care home operating under hold harmless undergoes a change of ownership, a change of location, the agency will use the previous points achieved from the facility's last star rated license assessment to assign a star rating at the end of the temporary license. This change in procedure supports transitional process of resuming the star rated license through a cohort model, and the new owner and facility will be expected to go through the star rated license reassessment during the cohort year established under the previous licensed facility. We just shared information about the 3 cohorts and dates that extend out to 2027. So while we want you to be aware of all the cohorts and the timelines, right now we are only focused on cohort 1. On the next few slides, we're going to highlight some programmatic and education support that's either happening now or will launch soon to assist facilities transitioning back to the rated license reassessments. Prep year, what will happen? Consultants will reach out to the facilities in the cohort applicable to that year. It'll help determine the needs and establish timelines for technical assistance and reassessments over the next 2 years. Consultants will share in conversations with facilities about timing of AC visits versus the rated license reassessment visit timeframes. They'll share programmatic and education initiatives, and they'll help facilities become familiar with technical assistance being offered in their territory. Remember, the preparation year for Cohort 1 begins this July. Consultants are likely reaching out to facilities within Cohort 1 now, and if they haven't already, will be soon, to be sure you're aware of the preparation year and the reassessment year, as well as working with you to discuss where your facility is right now in program and education to assist you both in knowing what you may need help with. Once you both determine your needs, then they can provide you with the additional information requested regarding the supports available. The North Carolina Rated License Assessment Project, often referred to as NCRLAP, has resources and training available on their website. 2 resources available are documents called Preparation Year, Environment Rating Scale Assessments, and Prep Year, Ideas and Activities. We encourage you to take advantage of these resources that they have available. It is important to note the Environment Rating Scales, or the ERS, can be requested during the preparation year, and they will be real, valid assessments. When referring to assessments offered through NCRLAP, your consultant will not use the term mock assessment. NCRLAP does not do mock assessments. Assessments can be used as guidance to enhance program quality. Assessment scores can be saved to be used during the evaluation year, or they can request another assessment in their reassessment year. In the past, a facility could not request a free assessment if they scored over a 4.0. That procedure is not applicable during the cohort prep and reassessment year process. The division will pay for assessments during a 2-year period, but if you do score over a 5 in the preparation year, then you will not be reassessed in the reassessment year, only those assessments scoring less than a 5.0. I know that was a lot I just said. So an example would be, in the prep year, the facility has 3 assessments, an ECHRS, an ITERS, and a SACRS. They score over a 5 on the ECHRS and SACRS, but do not proceed with the rated license reassessment. In their reassessment year, they would only have to have the ITERS assessed. The other 2 assessment scores would count and be used as part of the application. The low scoring assessment procedure that pays for another assessment that scores less than a 4.0 will come back into play in that reassessment year, but only for assessments scoring less than a 4.0 as currently outlined in procedure. Let's recap, as you may be asking. What if I get that environment rating scale during the prep year and you like your score? Can you go ahead and move forward with the rated license application? Absolutely, yes. You get to choose what happens to the scores during that prep year. Next slide, please. So programmatic support, as the consultant and operator or administrator determine the facility's needs, they'll refer them to local partnering agencies for technical assistance. If the facility earned 3 or more points in program standards, they'll share the options available to assist in preparing for the reassessment. Partnering agencies can offer technical assistance and training. Partners include, but are not limited to, the North Carolina Partnership for Children, or Smart Start, Child Care Resource and Referral, and the Child Care Health Consultants. Be sure you're familiar with and collaborate with all who can provide assistance during this prep year. It's possible that a partner in a contiguous county is offering something that may assist your facility, like a training. Don't hesitate to reach out and ask questions. The child care consultants are part of a team, so they may be aware of resources and trainings available in other counties, and would be happy to share that with you. Now I'm going to turn it over to Tori to talk through some of our education initiatives. Tori?
So now we'll be talking about the North Carolina Early Childhood Equivalency Exam. I'll be going over some questions that have already come up and possibly addressing some questions that you might have. The North Carolina Early Childhood Equivalent Exam is the new pathway option intended for experienced childcare professionals that an individual can take on the DCDE Moodle website. You need to ensure that you go to the DCDE Moodle website because it is specific to DCDE. So you can access the exam by going to, and this will be posted later as well. It's www.dcdee.moodle.nc.gov to access the exam. Now, some of the questions I'm going to be going over is starting now when I passed the North Carolina Early Childhood Equivalency Exam and received the North Carolina Early Childhood Equivalency Certificate, where can I use this certificate? Those passing the exam with a grade of 80% or higher will receive the new North Carolina Early Childhood Equivalency Certificate. This new certificate will qualify the individual to be a lead teacher, or family child care home provider in North Carolina. Next slide, please. What if I don't score high enough? Can I try again? You may make 2 attempts to pass the exam within 6 months. If you do not pass the exam the first time, you may attempt the exam once more. You will need to take the second attempt before 6 months has passed. If you don't pass the second attempt, you will be advised to pursue one of the other equivalency options. For example, EDU 119, you could take that at a local community college, the CDA, Child Development Associate's credential at a local participating North Carolina community college or through the CDA Council. Please note, there will be no professional development hours, contact hours, or college credit given for attempting or passing the North Carolina Early Childhood Equivalency Exam. Additionally, this exam does not take place of and is not equivalent to EDU 119. So with that being said, by taking this exam, does this mean I am testing out of EDU 119? No. The Division of Child Development and Early Education does not offer college courses or issue college credit. This exam does not take place of and is not equivalent to EDU 119. For information about EDU 119 and other college pathways, please contact North Carolina Community College System. I passed the quiz. What do I do next? Once you receive your North Carolina Early Childhood Equivalency Certificate, go to the DCDE Workforce Online Reporting and Knowledge System, which is WORKS, to upload your certificate and use your NCID to do so. When you need information concerning education qualifications, electronic applications, official transcripts, electronic uploads, and DCDEE works, who do I contact? You contact the DCDE Workforce Education Unit. That website is DCDE, or the email, excuse me, is dcdee.works@dhhs.nc.gov. Next slide, please. So we're going to go over some information regarding the next step, or what you need in order for you to take the exam. First, you need to be 18 years of age or older, have a high school diploma or equivalent, and you need your to create your NCID account. And that's how, and then if you do not have your NCID account, then there are directions on the website, the DCDE website that you can follow. Who's the typical audience that would take this exam? Some examples might be someone who wants to pursue the next step in their ECE career, or someone who moved here from another state and wants to meet the requirements for North Carolina. Can I take this exam if I'm a family child care home provider? Yes, an individual is eligible for the following position and position qualifications if they pass the North Carolina Early Childhood Equivalency Exam and are awarded the equivalency certificate. You can be a lead teacher, a family child care home provider in North Carolina. To be successful, applicants should be able to implement across developmental domains, such as developmentally appropriate environments and developmentally appropriate practices, guidance techniques, schedules, teaching strategies, And this should also support culturally, linguistically, and ability diverse children and their families in inclusive settings. Additionally, applicants have a basic understanding and knowledge base of early childhood education, being able to develop and implement a career professional development plan, know what NACE stands for and how it pertains to ECE, have a basic understanding of North Carolina licensing policies, procedures, regulations, and understand health and safety in ECE. Also, one of the questions that was raised is how long is the exam and what can I expect while taking the exam? This exam has 100 questions, which are made up of multiple choice and true-false questions. This is a timed exam and will be 1 hour long. And unfortunately, once you start taking the exam, you will not be able to pause it or stop it and try logging back in to finish. Please be sure to set aside 1 hour in conducive learning environment to be successful. If you need further assistance in taking this exam, please email us at dcdee.equivalency.exam@dhhs.nc.gov. And it is on this slide. Who administers the North Carolina Early Childhood Equivalency Exam? The North Carolina Department of Health and Human Services, the Division of Child Development and Early Education. And the Moodle website is listed here. And like I said, you need to be specific. You cannot just log on to Moodle because you would not be able to access the exam if you just log on to the Moodle website. It has to be this particular one. It's www.dcdee.moodle.nc.gov. Is there a fee to take the North Carolina Early Childhood Equivalency Exam? There is no fee. Is it okay to have help with completing this exam? Is it okay to search books or the internet for answers while taking this exam? No, you may not have help from a person, use notes or books, or consult the internet during the exam. The North Carolina Division of Child Development of Early Education counts on your integrity and honor in taking this equivalency exam. Please do not attempt to cheat. There will be an honor pledge that we are going to post on the website. And I will read this. The North Carolina Division of Child Development of Early Education has a zero tolerance policy for those who are caught cheating on this exam. By moving on to the first attempt of this exam, you affirm that you have read and understood the content of this document. You also agree to take the exam with honesty and integrity. And before I go on to the next slide, I just wanted to mention there was a lot of people asking if there were going to be any study guides or any type of information that'll be sent out so you can study for this exam. Actually, no, there will not be any study guides or any information that will be going out. Next slide, please. Now this next and that's enough and that's all about the early childhood equivalency exam. And if you have any questions, please feel free to put them in the chat, and we'll try to get to as many questions as we can. The next information that we're going to be talking about is credit for prior learning in early childhood education. Now, between June 30th and 2021 and January 31st, 2023, the Community College EDU faculty created opportunities for students to receive course credit for successful completion of Portfolio for Life and work experience. With that being said, we are going to talk about credit for prior learning. Credit for prior learning, and the acronym CPL you may see is curriculum credit awarded for college level learning obtained through prior learning experiences and other than curriculum coursework. College may award curriculum CPL when the documentation of prior learning meets or exceeds documentation of learning outcomes at the institution's standards for awarding credit for the corresponding curriculum course. So for an example, what is coming soon, it is, for example, for credit for prior learning, if a person has an active CDA, they can receive credit for 7 semester hours, which is EDU 119 and 151 with the CDA documentation. If the person initiates submitting a portfolio to the community college per review, they would receive an additional 6 semester hours of EDU 130 and 159 if all portfolio requirements are met. If not, they may have to enroll in the necessary coursework. It is my understanding that the articulation agreement will be finalized hopefully by the fall of 2023. However, each local community college can decide if they want to accept it. So while it's an option, it may only be available at some of the community colleges, and nonetheless, it is a great option for those who have the CDA. On the next slide, we're going to be going over some more updates and exciting news from the North Carolina Community College System. So the North Carolina, they're partnering with the North Carolina Community Colleges. They're partnering with the local high schools, and they're redesigning the ECE 1 and 2 high school course into one course, which is just ECE 1, and they have a specific name for it at the high school level. And we'll go over that in just a few minutes. Aligning content in the high schools and community college curriculum courses to support articulation. Partnering with North Carolina Department of Public Instruction, which is called DPI, you may see that acronym later on as well, to support North Carolina Career and College Promise, as well as career technical ed pathways and apprenticeship opportunities in our local high schools. There's a new pilot program that came out. It's called Building Bright Futures, and that supports early childhood pre-apprenticeships and apprenticeships in North Carolina, providing guidance, resources, and financial support to participants. Next slide, please. So here are 3 options that and pathways for high school students. Option 1, you successfully complete the approved early childhood education, which is called FE11, the version 2022, which actually was this last, semester this spring that just happened with a grade B or higher. Obtain a score of 85 or higher on the performance-based measuring portfolio, and enroll at a community college offering an early childhood education program within 2 years of their high school graduation date. So additionally, high school students shall be advised that, to be eligible for the NCECC, which is the North Carolina Early Childhood Credential equivalency, they must have received an articulated college credit for approved early childhood education 1 course by meeting all the criteria identified in the North Carolina High School and Community College CTE articulation agreement. You have obtained a high school diploma, GED, be 18 years of age, be enrolled at a community college offering early childhood education. And after meeting both sets of criteria, students applying for the NCECC equivalency should request an official college transcript showing articulated courses. An official college transcript and the NCECC equivalency completion information should be given to the DHHS Division of Child Development to determine eligibility for the NCECC equivalent. The option 2 is successfully completing the approved early childhood education FE11 version 2022 course with a grade of B or higher, obtain a score of 85 or higher on the performance-based measurement portfolio, have obtained a high school diploma or GED, and be at least 18 years of age. This option 2, after meeting the criteria, students applying for the NCECC equivalency should request an official high school transcript showing required courses and performance-based measurement score, an official high school transcript indicating the graduation, and the NCECC equivalency completion information should be given to the DHHS Division of Child Development and determine eligibility for the NCECC equivalent. And option 3 is complete the EDU 119 course, Introduction to Early Childhood Education with a C or better, and this fulfills the requirements for NCECC. Next slide, please. Over the past few months, the Workforce Education Unit has reviewed the degrees considered for different types of positions. Let's talk about some of those changes. The new degree considerations: early childhood child development BA or BS degree added elementary education, psychology, or sociology. School age with a BA or BS degree added children and nature, outdoor leadership, trauma-informed social work, and children. Evaluation of degrees will continue to be based on the positions requested, coursework completed, and the documented degrees awarded on official transcripts. For North Carolina Pre-K, these changes do not affect any lead North Carolina Pre-K teacher. DCDE must continue to follow DPI licensure requirements for lead teachers seeking licensure. These changes do impact North Carolina Pre-K teacher assistants, and the North Carolina Pre-K program. More detailed information will be shared as the North Carolina Pre-K updates program related information to reflect this change. Now I will pass it on to Allison.
Okay, before I get started, I did enter some information in chat, but I did want to let you all know, most of you have already figured this out, that the chat may or may not be working for some of you. So at the bottom right-hand corner of your screen, there should be 3 little dots. And if you'll click on that, you'll see a Q&A option. And we have lots of information, lots of questions coming through the Q&A, so that does appear to be working. So I just wanted to take a quick moment before we recap to let you know there's another option to enter questions. Okay, so now let's recap. It is important to remember that we'll continue to be in a hold harmless status until June 30th of 2024. Those of you who are receiving calls to start the conversation about resuming the rated license, it's only to share in conversation about it, to learn about the specific needs of your program, and to share with you helpful information as you prepare. Remember, during the preparation year, you decide whether or not to request the environment rating scale. And if you do, you can use the scores as a tool to help you prepare for your reassessment year, or assessment scores can be saved to use during the evaluation year, or you can request another assessment in your reassessment year and only have the assessments that scored less than a 5.0. Next slide, please. So in closing, questions added to the Q&A section of this webinar will be answered, and we'll post those on the DCDE website. We're going to kind of look through some of these questions right now and answer some that we can. So feel free to continue posting those, but we will go through all of them and post answers to all of them once we've developed that Q&A document. Additionally, I think you've probably already asked a few of or this has been asked a couple of times in the chat, but we will provide a copy of this presentation as well. And right now on the DCDE website, I will include the website, a link to the website rather, in the chat. But on the website, you're going to go to the provider page and scroll down to licensing, and then scroll over. I'm trying to do that as I'm talking. So to the star rated license, and then there'll be a new page that's been created called Resuming the Star Rated License. So once we finish the webinars, that will be this evening, but once we've had time to look through all of the questions, answer those, we will post the presentation and a Q&A document. So I'm going to enter the website address for any of you that need that. And then you can advance to the next slide, which is just we do greatly appreciate you all being here, spending your time here with us. We do have about 25 minutes left, so going to share in some conversation about the questions that you have.
Teresa has been kindly answering a lot of them as they come in.
Okay. Thank you, Teresa. There is a question about what is the CDA. I'm not sure if you saw that, Tori, if you want to elaborate a little bit on that.
The CDA is the Child Development Associate. It's like a credential. And there is a website you can go to, CDA. I think it's cda.com, and it has more information on that.
I'm getting questions again about the cohort. So one of them is if you were new or you chose to go through the modified assessment when it became available, where would you fall? So the way, if you want to go back to the cohort slide, let me find that slide. Perfect. So if you were, so these dates, you're going to look at the effective date on your permit that's hanging on the wall. If you would have been due, and I'm thinking this might be answering that one question, if you would have been due in 2020 and you chose to go through it, say in 2021, then you're part of the reassessment cohort for 2024. So everyone that is licensed right now and has a rated license, whether you were new or you went through, you're all part of a cohort. So depending on the effective date of your permit, then you should be able to determine what is 3 years out from that. And then that is your reassessment year that's due. So you likely, this person in the chat is likely in cohort 3. Potentially in 2 though, it just depends on if you had it in 2020 or 2021. And sometimes, just in case this question's about to come up, sometimes even though you're not due for a reassessment, you request a reapplication. And so that then changes, and you may have been just reassessed based on education. So if you're not sure, it's always going to come down to when your permit effective date is, but it could vary depending on the components within that. If you're not sure about what your due date is, then just reach out to your consultant. They'll be happy to assist you. Okay, there's a question about a relocation. So if you do a change of location or a change of ownership, then you're issued a temporary license. And at the end of that temporary license, the division's going to use the points and stars that you previously had at your other location and or the owner previously had. You'll fall into the cohort. So for that change of relocation, you'll fall into the cohort you were originally in. Typically, we would reassess you at the end of that temporary time period, and you would, but to keep everyone in the cohorts that we're reviewing right now, we're going to move forward with that. And I think it's on a slide, one of the slides, so we can pull that back up if we need to.
One question asks, can you keep your stars and not do your assessment?
Currently, I'm going to try to answer that. I'm not sure I understand the question fully, but currently we're in a hold harmless. So this year, this July 2023 through June 30th, 2024 is a preparation year. You do not have to do anything, but if you are operating with a rated license, you are part of this cohort plan, and you will need to be reassessed within the next 3 years. So if you're in cohort 1, that reassessment year would be starting July of 2024. Again, if you have specific questions about where you fall or which cohort that you're in, please feel free to reach out to your consultant. Someone asked what hold harmless means. That's a good question. So in 2020, when we were navigating the early stages of the COVID pandemic, we, for a brief period of time, we halted visits and everything. We were in a state of emergency, and when we resumed the rated licenses, we had a lot of barriers that facilities were facing, and there was legislation put in place that put everyone in this hold harmless state. And what that means is that you did not have to go through the rated license reassessment. You could maintain your current start level during that hold harmless. If you chose to go through a rated license reassessment, or if you were a new facility, which at the end of their temporary license, they would either have to have a 1-star license or apply for a rated license. Those facilities were not in hold harmless and they did have to apply. And so the secondary part of that hold harmless legislation was to decrease the requirement for lead teacher calculation of their education from 75 to 50%. And recently that hold harmless legislation was extended through next June. And thank you for that question, because it does, it would be a phrase you wouldn't know if you were new to the field. We are not issuing certificates for this webinar. It's information only.
Let's see, there's a question in here about questioning kind of the modernizing of the QRS and that being under review and not knowing, what new requirements are going to be. So I think it's, I wanted to say regarding the rating scale assessments, but I believe this applies to, the star rated license overall. We are talking about our current system. Every time we talk about the cohort model and the current assessment process. So in terms of the rating scale assessments, everything is the way it has always been. Okay, so they're the regular in-person observations followed by an interview, the regular random selection procedures if there are multiple classrooms that fall into the same rating scale. So there are no changes to anticipate for this upcoming preparation year at all. And, if you have any questions about what the assessment process is like, certainly, we've got a lot of resources on our website. There are videos about the assessment process. There are resources that would probably be really handy for, all of the newer teachers that are in the field. But, there are resources for family childcare, for centers. You might really want to think about kind of taking advantage of this preparation year, because I think obviously there's been a great deal of challenges and other things going on, but if your program hasn't been thinking a lot about the rating scales, kind of taking advantage of this time period to kind of dig back in and perhaps break it into smaller pieces, so it's not so overwhelming all at once, and think about a subscale. We have some resources around self-study that could be particularly helpful, and either doing at a program level or at a classroom level, encouraging pairs of teachers to work together, on the different worksheets and really kind of consider, what their understanding of the different requirements are. So anyhow, I hope that's helpful.
Someone asked to go back to that. Okay, we're on this slide. Can you go back one slide to the cohort planning? There you go. There's lots of questions in the chat about this. So again, if you, these dates, these years are the year you are due for reassessment, not the year you were assessed. So if you were due this year in 2023, then you're in cohort 2. That means you would have been assessed in 2020. Gonna see whether. I think we have touched on, we certainly haven't answered every question, but we've touched on the topics for each one of them.
Yeah.
So it looks like we might be able to give you about 10 minutes back of your time, but we do greatly appreciate you being here this evening. We look forward to providing the documents and sharing information on our website. And like I said earlier, your consultant, if they haven't already reached out, they will be reaching out. We are focusing on cohort 1 right now, so everyone will continue to get information, but you'll get specific information if you are in cohort 1 from your consultant. So they will be in touch, and you can certainly reach out to them as well if you have questions prior to hearing from them. And when we do post it, I'll say one last thing before I wrap up. When we do post the information on the website, we will send a newsletter. So an email very similar to the information that was shared regarding these webinars. We'll send one letting you know that the information has been posted. So we don't want you guessing and wondering and having to click on the website every day looking for it. We will alert you when it's posted. Thank you again so very much, all of you, for being here and for all you do.